Hello and welcome to Newsmax Health. I'm John Bachman. With us now is Dr. David Samadi. We're here to talk about what you need to know during physical exams. Men have for years routinely been given a PSA screening for prostate cancer, but now the test seems to be falling out of favor. Here with us to discuss the PSA screening guidelines is one of the nation's top prostate cancer authorities, Dr. David Samadi, Vice Chairman of the Department of Urology and Chief of Robotics and Minimally Invasive Surgery at the Mount Sinai School of Medicine. First, Dr. Samadi, the American Urological Association last week recommended against PSA screening for average risk men under 55 as well as over 70. Do you agree with these guidelines?
Well, I just came back from San Diego, and this was a big news at the AUA, American Urological Association, and every year they've been changing the guidelines for PSA. This obviously was a huge surprise and a big shock to the urologic community. And the concept behind this is that when you do mass screening, you're going to catch a lot of prostate cancers that may be low risk and they may not really cause this mortality or death. So the question is, why bother getting this kind of PSAs? The counter argument against this is that you're going to have a lot of men in their early 40s and early 50s that are going to have significant amount of cancer and chance of metastasis. So you're going to miss out about 10 to 15% of very aggressive cancers. On the other hand, about 40% of the patients there could be overtreatment. So AUA came with this guideline that we should not do any screening under the age of 55, and certainly over 70, it's not necessary. I think this is too early to really make comments on this. I certainly have mixed feelings about this. In my own practice, I have a lot of patients in their early 40s and 50s, which I think with this new guideline, they will fall through the crack and they would not just necessarily die, but they would have the cancer spread to their bone. So if you're watching this program, while these guidelines is for the whole country, and I'm sure there's some politics and financial issues behind these recommendations, you want to be very careful and look at your family history, find out if there's African Americans, they have higher risk factors than others, and individualize the care. Talk to your doctor and find out what's best for you. It is true that as a result of PSA screening, you may overdiagnose a lot of prostate cancers, but overdiagnosis should not lead to overtreatment. And if you have a good discussion, you may prevent some of those unnecessary surgeries. And that's one of the reasons why being with a doctor who's expert in prostate cancer is the way to go.
Now, if you don't mind, would you mind explaining a little bit more what you were talking about with the political and the financial reasons why this test is suddenly being viewed less favorably?
Well, but to screen, for example, between 40-year-old to 55-year-old, which they're recommending not to screen anymore, that's 15 years span of screening that we're not doing, which is going to save not only a lot of money, but perhaps prevent detecting some of those indolent or low-risk prostate cancers. The problem that we're having right now with prostate cancer is that our diagnostic tools are quite weak. So you may find some low-risk prostate cancer, but when you go ahead and you take the prostate out, in about 38% of the time, there is understaging and undergrading, meaning that before surgery, it's low risk. After surgery, you realize that there's a lot more cancer that you found in the prostate. And that's quite dangerous. And I think until we find some good testing, genetic tests, imaging, MRIs, and others, to really tell us what's in that prostate, it would be very difficult to tell men in their 45, early 50s, no screening. I think that's quite dangerous, and it's not really well thought of. But that's what the data says, and that's what we're going to follow at this point.
And so if I'm a man and I'm, say, 45 years old, and my PSA test comes back higher than expected, I should really talk to my doctor, consider my options before I go through the painful process of a biopsy, right?
Absolutely. And I think that if you have a family history, if your brother, father, uncle has prostate cancer, you are at much higher risk than the rest of the country, and you should be going for biopsy. It's always good to get a second and third opinion before you just ignore these PSAs. We know that PSA is not a specific test for prostate cancer. That's the fact. But it's still one of the best tools that we have, and it has reduced the amount of mortality by about 30 to 40%. So if you know how to use it, your doctor is comfortable with it, it works really well, and it saves lives. I think this new AUA guideline is a little, was decided a day before we got there. It's a little too hasty. But that's what we see based on the recommendations, and we'll see how it's going to pan out.
Let's focus in on that age group, the 55-year-olds to 70-year-olds. And can you tell us a little bit more specifically what makes that age window different than, younger than 45 and older than 70?
Well, one of the major risk factors for prostate cancer is aging. And as we get older, the risk of prostate cancer will go up. So they're basically saying that if you're over 70-year-old and you're not going to live long, and your longevity is not great, and other causes of medical issues such as cardiac issues, diabetes, high blood pressure is going to get you, then why bother do screening over the age of 70? So that window between 55 and 70, they think that this is the window where screening is going to be the most effective, and that's where you're going to get the bulk of prostate cancer that's going to really affect their quality of life, and it's going to get them and cause mortality. And that's why the AUA guidelines is coming in for that period. I see a lot of patients in our practice where they are in their early 40s with really aggressive prostate cancers. We're going to miss out that kind of population, and we're going to find them later on with much more aggressive cancers, with cancers that are already spread, and surgery is not going to really help them. So again, it's a mixed feeling. A lot of urologists that I spoke to, and we had about 17,000 of them in San Diego last week, there's a huge mixed feeling about these new AUA guidelines. We just have to wait and see which way it's going to go.
And so when I talk to my doctor, and because there are these mixed feelings out there, how do I know what is the next step in the process if my PSA reading comes back high?
Now, the way things are set up is that your doctor is not going to tell you to get the PSA, but you're more than welcome to ask them and say, look, I'd like to know what my PSA test is, just like your cholesterol. But, if your PSA is high, we don't have to jump into biopsy. We can treat it with antibiotics, making sure that there's no infection or inflammation, etc. If it continues to stay high, then we will get the biopsy. What they're saying is that because biopsies are random and they may not find it, then why bother do it? And I think that's just a bad decision. So I get my PSAs every year. I follow them closely, even though I don't have any family history of prostate cancer, but I know that information is important to me. And you'll be smart about how you're going to act on that PSA. So I would still caution people, even though we have a new AUA guidelines, that changes almost every year. Every year that we go, my concern is to a lot of people out there who we're going to miss their cancer. Certainly, if it's a low-risk prostate cancer, you may or may not need to go for surgery, but there are also moderate risk of high-risk prostate cancers that we need to know ahead of time, and we can cure them from this disease.
Yeah, and it reminds me, a lot of men need to look at their health like they look at their investment portfolios and check in on
Absolutely, but John, I will tell you that as time goes on, and as we get these genetic studies, as we get better imaging and MRIs, we're going to really narrow down the kind of patients that need to go for surgery and the ones that we can absolutely watch. Until that's part of our practice, just to tell people not to get PSAs, I think it would be a huge mistake.
Yeah, it's constantly evolving, and that's why we thank you for being with us today, Dr. David Samadi. Great information here for all men out there. We'll talk to you again soon.
Thank you very much.
And thank you for watching Newsmax Health.